Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. Anemia, dental caries, implication in palpitation. Those three conditions that I mentioned, anemia, dental caries, and palpitations, are very popular conditions, disease situation that one suffers from, especially the older one becomes. I believe that any person that is an adult watching this video will surely must have come across or experienced anemia, dental caries, or palpitation, right? The anemia itself is when you have iron deficiencies, and it's usually a problem that you may not know except the laboratory diagnose it. When it's very serious, you could also ordinarily use the pallor of the hands or the eye when you look at it and it's becoming white, or the nails when the blood cells are not showing the hemoglobin. Is that hemoglobin that is not in the red cells that makes one anemic. So in the laboratory, that is what is usually estimated for. The dental caries is when plaques form on your teeth, and bacteria are in these plaques. They start producing acid by once they are fermenting, growing, they produce this acid that eat up the enamel of the tooth, and the hole start getting deeper, and the pains and the inflammation experience could also be serious complications. Palpitation in itself is that fast heartbeats, that irregular fluttering beats. So when we look at these three conditions together, what are their implications in palpitation? Because palpitation is a situation that has to do with the heart, and the heart problems usually is chronic as one grows older in age. Thus, the palpitation that we experience ordinarily leads to heart problem. These are the implications that I want to examine in this slide session, and also to see how anemia and dental caries could be a serious factor in the palpitation experience, or whether if one makes effort at correcting any of these two, the palpitation will disappear, and also the implications that palpitation itself has. So as we move on to the slide section, I will also want you to understand that the role of the laboratory is my major concern in helping you, that is, the laboratory at helping you to be of very good health, so that you can have confidence in your health. So the laboratory is that place where confirmatory diagnoses are done, so that whatever the laboratory brings out, it gives you that confidence to really not to boast, but to feel very healthy. There are so many laboratory tests that could be done, but all this I shall expose in the slide section. So as we move into the slide section, as usual, press the like button, subscribe for more. The outline: objective introduction, disease complications, laboratory diagnosis and recommendation. The objective: to expose how anemia and dental caries are implicated in palpitation, the various laboratory investigations done to confirm it, and the complications that may arise from these conditions, and when to seek clinical intervention. The introduction: anemia is a condition characterized by deficiencies of red blood cells or hemoglobin. Globally, it is estimated that 40% of all children aged between 6 and 59 months, 37% of pregnant women, and 30% of women 15 to 49 years of age are affected by anemia. When you look at these demography, you want to wonder why women. What we're looking at is the menstrual period. Because of these menses, the women are prone to anemia. That's why the focus is on them and children. They are very susceptible to anemia. And WHO target is to reduce it by 50% by 2025, which is last year. How they have been effective in it, I don't know. Dental caries are common chronic infections from tooth-adherent cardiogenic bacteria, Streptococcus mutans, and other species that metabolize sugar, producing acid that demineralize the tooth enamel, showing visible holes over time. Heart palpitations are feelings of having a fast-beating, fluttering, or pounding heart. It is harmless if it doesn't last more than some few minutes, but it could be a symptom of serious heart conditions, and you need to watch it because heart failures grading are exposed at the end of this video for you to know how to know when to quickly rush to seek medical help. The disease complications. Anemia can lead to heart palpitation as the body compensates for reduced oxygen level, just as I had earlier explained in the video, which may also affect dental health by increasing the risk of gum diseases. It makes the gum more vulnerable and tooth decay. It's important to address both anemia and dental issue to maintain overall health, especially now that this study is seeing relationship with the palpitation, that is being implicated in palpitation, and palpitation, dental caries is even being implicated in arterial fibrillations, which is a more serious complications. Chronic anemia increases the risk of gum disease due to poor blood supply, tooth decay. Nutritional deficiencies associated with anemia can weaken teeth. Dental caries can cause one, low-level bacteremia, yes, the blood, by which oral bacteria enter the bloodstream at inflamed sites of the oral cavity and invade the heart. So you can see the heart gradually becoming disease. Systemic inflammation induced by inflammatory mediators, which are released from the site of oral inflammation into the bloodstream, affects cardiac remodeling. So the palpitation that you will witness is as a result of this inflammation and bacterial infection going on there. Yeah, let's look at other common causes of palpitation. We must not believe that palpitation is only being caused by what we mentioned, anemia and dental caries. Emotional and physical factors, the stress, anxieties, panic attack, and vigorous exercises will cause it. Substances and diet, caffeine, yes, it's very common. Nicotine, alcohol, and dehydration would cause palpitation. Medication, decongestants, asthma inhaler, diet pills, and some heart medicine. Medical condition, thyroid disease, low blood sugar, hypoglycemia, anemia, and heart rhythm disorder, all allergic reactions. The laboratory diagnosis, like I had said, the laboratory is that place where confirmatory analysis, diagnosis are really possible and done. To confirm the cause of this anemia is easily done in the lab. If you suspect it is the blood, red blood cells that are not enough, you can do pack cell volume, but usually there are other implications. So the iron profile checks really for the iron, The heme, the various tests is the serum iron, ferritin, transferritin, and as listed. Bacterial culture and sensitivity for dental caries, so that the right drug is taken to cure these mouth organism to prevent true decay. The palpitation blood test is done, thyroid function test, electrolyte balance, and anemia. You could also do this invasive technique and other, things that involve that are outside the laboratory: electrocardiogram, Holter monitor, and wearable devices, event monitor. These are all possible things that will help to diagnose the palpitation. Finally, recommendation. The implication of chronic anemia and dental caries are the concomitant effect on the heart. You now talking of complications affecting one's heart, because when you start experiencing congestive heart failure, it is probably because there are these little signs that you are not correcting or not taking care of. So the chronic anemia could degenerate further than that, but palpitation usually is seen as mild, but palpitation is a sign of heart problem. When you see it, is part of the signs that the stages of heart failure, which I shall expose the last part of this video. These two diseases are preventable. That's anemia and dental caries. And prevention is better than cure. Anemia prevention is a balanced diet, except where there are hemoglobinopathies, cancer, or other conditions reducing red blood cells. Dental hygiene will prevent dental caries, especially when fluoride is used. Fluoride helps to prevent the dental, the enamel from being easily digested, especially with a reduction, and also with a reduction in sugar intake. Palpitation could also be caused by caffeine, and all those things are the earlier listed: stress and overactive thyroid gland. And so there is a need to know what you are allergic to that could trigger palpitation. Finally, know that palpitation is one of the signs of heart failure, especially if it comes frequently and stays for long before it's resolved. So let's look at the stages of heart failure, that if we see it with our palpitation, then we can. Yes, we need to understand the stages of heart failure so that we can use it to see whether our palpitation needs medical intervention, urgent medical intervention. So it's usually given as class 1 to 4, with 1 being the least severe. Class 1 of the heart failure, what you observe is you don't have any symptoms during normal physical exercise. So it has to do with physical exercise. Things you do that you feel stress, or you cannot breathe well, or you start having chest pain. So when that is not being experienced at all, that is class 1. But class 2, you are not comfortable you are comfortable at rest, but normal physical activity trigger symptoms. You start experiencing palpitation. The class 3, you are comfortable at rest, but minor physical activity triggers symptoms: the chest congestion, the rapid heartbeat, and palpitation. Then the class 4, you are unable to carry out any physical activity without discomfort and may have symptoms even when resting. So that really tells one that there is heart failure seriously when the heart will finally pack up. So this is my effort at helping to keep us in top shape, having confidence that at least we are managing our health. We can't boast of it, because accidents and what have you could happen, but the one we can take care of, let us take care of it, and thereby increase the our lifespans and also the longevity of the country we belong to. There are so many things involved in keeping ourselves healthy. There are so many videos that is on this my channel that is all concerned with the laboratory effort at keeping us in top shape, very healthy.